This is Dr. Cruz from Kentuckiana Integrative Medicine, and we're going to interview Dianne Fisher. So, Ms. Fisher, is it okay if we put this video on the website and the internet?
Yes, it is.
Okay. So tell us what brought you to Kentuckiana Integrative Medicine.
So I started out with a lot of pain in my knees, hips, and back. And I was going to a medical doctor where I was basically just told to take muscle relaxers and pain pills, and I was going to have to live with it. And so I started to seek out what else I could do besides just start living on those. And I literally was introduced to Dr. Cruz by a friend at my church, and started to come in and just sit down and really go over everything. I had MRIs done, and Dr. Cruz laid out a plan for me to have the stem cells. And I had that done 2 weeks ago, the first set of stem cells. And I'm feeling absolutely awesome and very grateful for what I've done.
How were you what were the things that you couldn't do before your last set of injections?
Well, as growing up, I've been very active. I grew up on a farm, and I helped my husband. I was his caretaker, so I could physically do anything I wanted to. Well, suddenly I couldn't do any of it. I could barely take care of myself, just a lot of pain with everything I tried to do. I literally got to, right before the stem cells, I was literally walking with the cane. And as of today, no longer using the cane, no longer having pain, nothing more than some stiffness that I'm just starting to work and use my muscles again, so it's going to help me get back to my old self. And I'm feeling younger every day.
Awesome. Before you were walking, but you could only walk how far?
Literally just less than a half a mile. I couldn't stand for any lengths of time at all. And now I've can walk for 2 or 3 hours at a time, and I can stand for an hour, but I am shifting my weight back and forth. Then, like I said, just a little stiffness right now that I'm working through right now.
But you're pain free when you walk for 2 or 3 hours.
Pain free, yes. That's absolutely.
Awesome. And Dianne is the business owner of
L&D Mail Masters.
L&D Mail Masters, which is a phenomenal marketing company, and she's helped us. But I'm pointing that out because she has to go to work. She runs the place with 100 and
we have 80 employees.
80 employees, yeah, that depend on her leadership, and so she's standing and walking all over this giant facility, keeping things in order. And she was having a lot of difficulty doing that until she got treated with stem cell therapy. And we gave Dianne prolotherapy, prolozone, platelet-rich plasma injections, and personal stem cell therapy injections because her arthritis was so severe that we knew we were going to need to use extremely large quantities of stem cells. So Dianne let us harvest stem cells from her abdomen, and then we sent them to Florida, and we grew them to 100,000 stem cells. And so with each session, she's gotten the equivalent of 50,000 stem cells. And this is her second series of injections with her own stem cells that were grown into the millions. And we're very happy with her results. When did we inject you last? 2 or 3 weeks ago? I can look it up.
December the 5th, I think it was.
Yeah. So great. So we're really happy you're doing so well, and we appreciate you doing this interview because somebody of your stature in the community has a lot of credibility, and that helps us. Because believe it or not, there's still a lot of skepticism against stem cell therapy, and among doctors, and needless to say, the FDA and Big Pharma don't like it in spite of how effective and safe they are. And they keep saying unproven and dangerous, and in 15 years of doing this, I've yet to have serious complication, and the majority of patients respond beautifully. which is great for me and for the patient, you know, because there's a lot of other procedures where the chances of success are not nearly as good. And I think you're going to be able to avoid, you know, knee replacement for many, many years to come. So thank you for interviewing with us.
Thank you.
So why don't you let Dianne